with hip fractures, the times that we, most often we will in general operate on those on a fairly regular basis. There are times where if somebody has a fracture that is minimally displaced, and they have multiple risk factors that put them at a high risk with surgery, we can try to treat that without surgery and see how they tolerate it. Sometimes if their pain is too great, they may not tolerate it, and then you start weighing the risks and the benefits along with it, and you might think, well, because it hurts so much, it may be worth taking the risk trying to get this fixed. Whereas most are displaced enough to where there really aren't any good non-operative measures in that situation. Our goal is to try to get you back as soon as we can, to try to minimize the downtime. So the longer you're waiting, the longer you're laying in bed, the higher the risk, or the higher the chances get that you develop blood clots, that you develop a pneumonia, that you can get pressure sores, things like that. And none of those things are ever a good thing. So we want to try to do these usually as quickly as possible, but also as safely as possible. There are studies that show if you get it done within the first 3 days of admission, or actually the first 3 days after the injury happens, the outcomes tend to be a little better. So the longer you wait, the more likely you are to have problems, and that's common sense whenever it comes down to it.